Hi, I am Dr. Mangesh Kamath. I am a senior consultant medical oncologist, hemato-oncologist, and bone marrow transplant physician. I practice at Helios Cancer and Hematology Clinics in Bangalore. Most of the patients with cancer in my practice belong to the age group of more than 60 years old. And the commonest question that I encounter from their relatives or attenders is, Doctor, can my patient tolerate the chemotherapy or the treatment that you are planning for him or her? It is indeed a very difficult question to answer because, as a medical oncologist, I am here to make sure that the patient gets better. Then, why is it that there is a lot of fear with regards to the treatment that I am going to offer to the patient? The roots of this belief goes back to 2 or 3 decades ago when patients used to have a bucket in front of them, a bowl in front of them, so that they don't vomit after taking chemotherapy. We have gone a long way from that time, and today, vomiting due to chemotherapy has been reduced to almost the most minimal of symptoms. But it is also true that a lot of patients of the elderly age group have a lot of comorbidities. Some may have a heart problem, some may have poorly controlled diabetes, some may have very difficult to control hypertension, and many other issues such as osteoporosis and joint pains and so on and so forth. So, how do we manage patients with this kind of comorbid conditions? So before we step into that, I would just like to educate you to the fact that as a medical oncologist, I would have first done my MD in general medicine and then my subspecialization or super specialization in medical oncology. And the reason we have to go through this path is so that we understand each of these comorbid conditions such as diabetes and hypertension, and then while we balance these comorbidities on one side, we have to give the treatment so that the cancer can be cured or controlled. So the rest of the story becomes a lot more simpler when we analyze and basically evaluate the patient and design the best therapy. For many cancers, there is not only one kind of therapy that is available. We have multiple options, and these options are available so that we can design or protocolize the best treatment for a particular patient of a particular age and a particular comorbidity. So it is not to be feared that there are going to be a lot of side effects, but it is also not to be something to run away from. You can definitely take the best therapy without having to endure side effects with today's treatment armamentarium. We would make sure that not only the treatment for the cancer, but various other aspects that are very important in the elderly age group, such as psychological assessment and management, nutritional assessment and management, exercise, and basically tailoring the best kind of exercise, various other aspects, the spiritual aspect, are all taken care of while we manage patients who are elderly and with cancer. Sometimes we may not even give the most standard of treatment because the patient may not be able to tolerate it. The patient may be weak to start with. But at the same time, sometimes we have to be a little aggressive, especially when it comes to certain cancers such as lymphoma or cancers of the breast, wherein patient may not be in the best condition, but our treatment may make the patient better. Yes, indeed, it has been seen many a times, not only my practice or other medical oncologist practice, that it is possible for patients' general condition to improve after even chemotherapy. The weight of the patient tends to improve when we give chemotherapy and the advanced malignancy responds to the chemotherapy that we give. But is it chemotherapy that we give all the time? Not really. Today we have hormonal therapy, targeted therapy, immunotherapy, all of this can be given even in the most elderly age groups such as 80s and 90s so that we can control and win over cancer.